Please go ahead and introduce yourself.
Okay, my name is Kyler Galford, and I'm a graduate marriage and family therapist intern here at the South Shore Center for Couples and Families, and I also do work at the Pearland Center for Couples and Families. I'll be graduating this May from the University of Houston Clear Lake's Marriage and Family Therapy program, which is a nationally accredited program, one of the best in the country.
Where are you from?
I grew up in Sugar Land, and then I moved to Clear Lake in '99. So this has been my home since then. I have great ties to the community. My husband lives here, and so I think that this is going to be our home for a while.
And tell us a little bit more about your family.
I am the middle child. I have a blended family. My parents divorced. In high school, it's been a really unique circumstance because I think that it taught me a really valuable lesson early on that no matter what the circumstances are, you can really grow from a hard opportunity and you can become a stronger family because of it. So it's a unique circumstance in that everybody can get along and we get to, have some experiences that I don't think a lot of families get to have.
So what made you want to become a therapist?
I had always just been drawn to kind of the helping profession. I remember as a child I wanted to be a veterinarian because I liked the idea of just kind of being instrumental and making a difference. And then once I got to high school, I really was exposed to the field and it just grew from there. So I made it my concentration for my bachelor's, and then I did a minor in anthropology, and at my university, I got exposed to the idea of family therapy, and from there it just seemed to click for me because I liked the idea of intervening on the whole system versus just intervening kind of at one individual level. I think we're so relationally bound that I think that needs to be the area of focus because you can make a bigger difference adjusting the whole system versus just hitting those little parts.
What do you think is the biggest misconception about therapy?
That's a tough one because I feel like kind of the stereotypical we lie on the couch and we just talk to the blank therapist has really been kind of deconstructed at this point. I think probably now we're still kind of battling this misconception that you only go to a therapist when you have problems. Because therapy can be a way to address any area of your life that you feel it could benefit from growth or enrichment. And then also highlighting those strengths that maybe haven't had the opportunity to really be utilized.
So how does that affect you as a therapist?
The major effect that I think it has on me is just building an alliance, building a relationship with a client, making it comfortable, making it safe, making it our priority that their autonomy and their life path is the goals that we're going to work towards. We're not going to be very prescriptive. We're going to work on the things that they feel like are important. So that way therapy meets with whatever their values are, their beliefs are, and it's consistent with their life. It's not my perspective or a theory's perspective about what we should be working on.
So what's one of the better experiences that you have had as a therapist?
I think the better experiences that I've had, I've seen couples and families and individuals come in really hard places. They're trying the best that they can to cope with some difficult situations, and then to see them grow and to see their resiliency and their strength. And then once they're ready to transition out of therapy, I think that's kind of the most rewarding part, is just kind of being able to witness their transformation.
So you talked a little bit about your schooling and background.
Mm-hmm.
Is there anything in particular about your schooling that has helped you as a therapist?
I think the thing that has really impacted me is the professors and the classmates that I've had, because I think that they offer an environment where you can really learn about yourself and then learn about other opportunities, other techniques, other fields. I was introduced to medical family therapy which addresses the needs of individuals and families who are dealing with chronic illnesses or cancer diagnoses or weight management. And so I think just being introduced to that as a possibility really aligns with some other interests that I have. My background is in personal training and in fitness, and that was what I did to get me through my undergrad. And so I think it was just this perfect marriage of saying that these are values and principles and interests that I have that line up perfectly, of saying the fitness side and the wellness side for relationships and for individuals.
So why fitness and therapy?
I think that it actually aligns really well, because if we're addressing our physical needs, at the same time it makes it easier to address relational needs, social needs. Oh, can we edit that?
Yeah.
I think fitness is a huge component of our overall health and wellness. We're more than just kind of one small component, and so we need to address the physical, we need to address the emotional, the spiritual, the relational, and I think when you look at the whole picture versus just this same thing, kind of one part, it enriches your life in a way that you couldn't have imagined.
Good. And I can't remember, did you say where you got your education from?
Yeah, I did my bachelor's at University of Houston, and then I'm finishing up my master's at the University of Houston Clear Lake campus.
Okay. Great. Is there anything else you want to add?
I don't know. I guess maybe just kind of talking about my therapeutic approach. When I'm working with clients, I try to make sure that it is a collaborative relationship, that it focuses, on making the environment safe and warm and welcoming, and it's supportive for them. I really don't know what else to add. I think that's about it.
All right. That's good.